I'm sure you guys will start to see that when you start seeing a lot of people. But it's really quite magical. The issue that I had with it is being the end of the line for a lot of people. A lot of people, I could tell you everybody's history. They went to their doctor, they were prescribed um, muscle relaxers and anti-inflammatories. They might have gone to physical therapy. Then they went back to their doctor and they were prescribed opiates. They might have taken them, they might have not. The next step is surgery. And some people do that, some people don't. But one way or the other, they end up in our office. And what frustrates me the most is that we have an honor and a duty to refer our patients out to whatever specialist that they need. And when they are not getting the referrals that they deserve into a chiropractic office. So that frustrated me greatly. Not for our business. Our business is like people are knocking down the doors to get in here. It's because the people deserve to know that this is an option for them. So what I did, I printed off a bunch of research for pediatric and perinatal cases because we actually have quite a lot of research on that specifically. And I went to every single pediatric office, a pediatrician office, and every single OB/GYN office in the area. This was, by the way, this is BC before COVID. So I was actually able to go in there and basically got laughed out of every single office. Didn't get one phone call, have not received one referral, even though we have, we call it a turn rate of 100% for breech presentation. Earaches just go away. Kids that have a previous autistic diagnosis start making eye contact, start laughing, start having social interaction. And a few of them have been able to get that diagnosis dropped. And yet we are the last in line. By the way, moms are really catching on. A lot of the big reasons why people bring their kids in is from Facebook. So I'm not really on Facebook, but moms are. So, but that really frustrated me to the point where I started really thinking about getting into the research field. The more research I did on the research we have, I realized that we have a lot of research. So in my mind, I was like, oh, well, if we had more, then maybe the government would pay attention to us and actually have some kind of portal or referral to get the people the care that they needed. And then what really sealed the deal, I had a good friend of mine pass away from heroin because of an injury he had to his back. This was before I was in chiropractic practicing, of which he had the same thing happen to him where he was prescribed opiates and got hooked on it. And he passed away last year. And it really tore me up. But then the next day, a woman came in. Her name was Haley. And she came in because she wanted to get off heroin. And it really clicked with me that I was like, wow, I'm in the right place, right? And she was doing great. She was getting off the drugs and everything because she was on heroin because she was in a lot of emotional pain and in a lot of physical pain as well. But she ended up having to stop because her insurance did not pay for this. And even though we were seeing her at a reduced rate, she was unable to afford it. So it's just like all of this frustration built up basically in me. That's like, not only do I want to help produce more research so that we can get the referrals that we deserve, and also so that insurance can pay for it, so that the people can actually receive the care. Now, we actually work mostly cash based here, but still, that the insurance barrier is a huge reason why a lot of people do not get the care that they really need. But after that, I just really started to put my head down in just taking our own numbers here, and seeing the changes, because there are so many ways to measure the nervous system and changes, and they're cheap. And they're always happening. These changes are happening. And if we can just be kind of a passive note taker, then you'll get to see that progress. So we've seen a lot of people be able to come off thyroid medication, blood pressure medication. A lot of times, though, if you're not taking the numbers that you need to, then you won't be able to really prompt the person like, hey, you need to go ahead and talk to your doctor about either lowering your medication or seeing if you can get off of it. So super cool stuff what we do as chiropractors, and definitely the more that I learn about the how, and looking back at being in practice and being able to really put to use all that we did learn in school, for me, it really deepens my why. Like, it just makes it that much more real of what we do. Because even though a lot of the objective machines and technology that we have today to measure things, it doesn't actually touch the surface of what we actually do. You can still see a lot of changes neurologically, and then therefore viscerally, and you can see it in people's moods. And I mean, no one has really gotten sick here in the office. We are wearing masks. I don't know how everybody feels about that, but here it's like this safe place for everyone, that they feel comfortable and normal, which is good. Even though in Virginia, there is a very strict policy where you will get fined a misdemeanor if you are not wearing a mask inside. So don't tell on me. But I think it has, I mean, we could talk a lot about the research behind that, which anytime if you guys want to reach out to me about that, I've been really looking into all of that, and I'd love to help anybody understand that needs more clarity with it, with that. But that's not what we're going to talk about today. We are going to talk about our wheelhouse, which is health and wellness, and the spine and the relationship it has to the spinal cord, and the relationship that has to the brain. Because when you look at a picture of the brain, and the spinal cord is up in there, right? And it's a continuous organ. It really shouldn't be considered something separate from the brain. And what we do as chiropractors to free up the joints and allow for motion to happen, especially right in here and L5S1. When you have that proprioceptive feedback, it literally ignites the brain. Like, if you could see light, because we can't see light, we can only see what the light is catching, right? We see the dust particles in the air, and that's why, among other things, and that's why we can see the light. We're not actually seeing light, we're seeing what the light is catching. But if you could, after an adjustment, the brain is lit up. And that is straight out of Dr. Heidi Horvick's research. I used to think it was Havoc too, but it's Horvick. Of which, if you have not looked into her research, definitely do yourself a favor. And she has a great book called The Reality Check that goes into that. But it really focuses on the frontal lobe. She dives into a lot of somatocortical area, but I think that as we go deeper, we're going to start seeing other areas of the brain as well, being not only stimulated, but regulated. Regulation is really the big deal of what we do. So if something is too high in somebody and the same level is too low, nice. Yes, Zach, that's great. Then chiropractic can help bring up someone's levels that are too low and help bring down levels that are too high. It's very interesting. It's very person dependent. So I'm happy that you guys already know Heidi's work. If you were to just look up HAAVIC and then chiropractic, you will see a bunch of different studies. I just posted one today. If you're following me, you might have seen it, but it was on stroke victims. And these are chronic stroke victims, by the way. And having a gained strength reflex in the plantar region, which is amazing because I have a roommate and she is a speech and language pathologist and she works with stroke victims. And she says that every single day that goes by, it's like they have less ability to make any progress. And to see a study that has immediate progress after one adjustment in their strength for chronic stroke victims, she reached out and she said, no way, this is amazing. So what we do is unbelievably important. So another reason why what we do is so important is because right now, specifically, we have a good amount of friction, not just from the AMA or anything outside of chiropractic, but chiropractic associations themselves are putting out statements. I'm sure some of you guys have seen it. Canada specifically, the Canadian Chiropractic Association put out a statement saying that there's no scientific evidence that chiropractic can affect the immune system, which is completely false, because we have multiple papers strongly suggesting that we can regulate interleukin 2, B lymphocytes, T lymphocytes, neuropeptides, lots of different things that if we were to just go in there and check the numbers pre and post adjustment, we would be able to say, hey, look at this though. So right now, chiropractors in Canada are being fined or they're losing their license over Facebook posts about saying, hey, protect your immune health with chiropractic. So it's now more important than ever, not only to keep our doors open and establish ourselves as essential, but for the people deserve what we have here. And if you were to really look at the numbers, if we were organized enough and potentially had enough, I don't think the answer isn't in the numbers, right? The answer is in the actual what happens person to person that they see. But if we had enough inertia, then chiropractic would have been one of the excellent answers for any kind of pandemic. I don't really want to call it a pandemic. Instead, I just call it lockdown. But would have been an excellent answer to this lockdown situation. So maybe next round in 100 years, we'll see where we're at. But um, look forward to that day, because I'm sure we're all going to make it. Living the chiropractic lifestyle. Speaking of the chiropractic lifestyle, there is an overwhelming amount of research supporting the chiropractic lifestyle. Now, they like to call it fancy things like exercise science, or sports medicine. There's nothing wrong with either of those things. They're amazing fields of study, but it focuses generally around motion, which is what we do with chiropractic all day long, is normalize motion, which we mentioned that earlier before. Motion in the joints stimulating the brain. So not only does the adjustment put an acute force into the joints, but or one joint, depends on which technique you're using. But then as the day goes along and that joint is normalized, the motion itself is helping stimulate neurogenesis, helping stimulate the at least the frontal lobe, but also something that I'm really interested in looking at that hasn't really been done is the effect on the cerebellum. There is a load of research now linking the upper cervical musculature in the neck to the eyes. If you haven't looked at that yet, just type in to Google PubMed, upper cervical musculature eyes. That's all you need. And pages will come up linking stimulation of these muscles to the eyes being stimulated. So there is direct relationship between those two. So, and I'm not sure if anybody is a functional neurologist nerd out there. I was a little bit in school, and now I'm doing the fellowship. It's a bit grueling, but hopefully worth it. Anybody else out there, please reach out. Let me know how it's going. But what was I going to say about that? Regardless, when we can normalize the eyes, it is actually a sign that the brain is healing. And that's not just in what we do as chiropractors, but lots of different fields have been studying the eyes as a window into the brain for a long time. And when you're testing a kid, specifically for me, and kids bounce back a lot faster than their parents do. But when you're testing a kid's eyes and they're not tracking well, or that they're not able to converge properly and different things, after an adjustment, every time it's more normal or normal, which is telling us that we are affecting the brain in more ways than one. So it's really interesting. A lot of people, like, they just accept that, like, when somebody comes in and they're like, oh, my shoulder is hurting, and then you look at their spine and you're like, oh, I think it's coming from your neck. They totally get that, because like elbow bone's connected to the shoulder bone, connected to the neck bone somehow, right? But when you're looking in the brain, it's the same deal, right? Thalamus is connected to the hypothalamus, which is connected to the pons, which is connected to da 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 da. But unfortunately, not a ton of neuroscientists think that way. It's highly mechanistic. So I do think that hopefully, as more vitalistic research is conducted and shared, the more the tide will start to switch on that as well. HRV. Now that is a really cool way to test what's going on in the brain in terms of regulation, because that's just kind of one of the gold standards that the scientific community in general as a whole is starting to use for overall health. Um, so it's our brain's ability to regulate our body, right? Uh, so right now, what we're doing at Life, I just got a job 4 or 5 months ago working with Dr. Stephanie Sullivan, who is a genius. I'm so proud of her, what she's doing um, with how her mind works. So her idea is, and I'm her assistant. Basically, her bitch, right? So whatever she tells me to do, I'm doing it. I'm reading through different studies and notating exactly what the study says, the results, how many participants, all of that, because we're creating a systematic review of literature. Taking one by one, we're taking different idiopathic diseases. Right now, we're doing ischemic heart failure, so heart attack, myocardial infarction as well. But we're starting with the heart, and we are tracing back autonomic predecessors. And there are thousands of studies linking up dysfunction with heart rate variability specifically to these diseases. And all-time mortality rate, so meaning that they could die from anything, is high, very high in the groups that have disaffluented heart rate variability. And then if you go to the chiropractic side of things, then we have a big handful of studies showing how chiropractic improves heart rate variability. So, I mean, it's pretty obvious how chiropractic can affect the brain and therefore the entire body, just from the giving inferences from that alone. Which is really important because, like, back in school, I was your typical, like, talk the tick kid that was like, oh, we don't need research in order to prove what we do. Like, this is proof alone. Because I actually had a bad taste in my mouth about evidence-based science, evidence-based anything, because number one, the issue I said before with we don't have all of the objective tools that we would need to really study like what's actually going on, right? The tools that we have, even albeit they're very advanced for the time. Nice. Ooh, I'm gonna have to look that up. I haven't heard that. But not as advanced as the technology that we have interrelated within ourselves. But what really turned me off even more was that a lot of the evidence-based schools are very musculoskeletal based, which, again, there's nothing wrong with that. It's just really boring to me. Like, yeah, we're great at headache, neck pain, back pain, sciatica, hot discs. There's a ton of research on that, proving time and time again that we're good at that. But what about everything else? What about the ability, the proprioceptive ability of our body to even know where it is in space? And if we don't have that proprioceptive ability because a joint isn't moving, how does that affect our brain in terms of sympathetic mode? If you say all of a sudden you lost the ability to see, feel your hand, like you had no perception of it, it would put you in a fight or flight response immediately. So every single joint within the spine, we know that there's actually multiple joints within one joint. If things are out of place and they're not moving properly, sometimes not moving at all, then it's going to have implications on the brain. And to be able to restore that motion is going to turn on that HPA parasympathetic expression, which is where we do our healing and where we do all the important stuff, whether it be digest our food or making babies or whatever it is, or even being able to fall asleep so that we can heal, has to do with turning on that switch. So another reason why it's important for not only for people to be in the lab taking numbers, but then also for our doctors to be taking numbers as they wish in their own practice, because there are a ton of people that are catching on to this and using now what's called vagal stimulation, if you've heard of that. So there's a lot of research going on right now in the pharmaceutical world, talking about vagal stimulation and turning on this HPA cascade of parasympathetics. I'm going to turn my, there we go. I'm going to turn this down. That if we're not careful, I hate to put like the other side and call them they and everything. But if we're not careful, this mechanistic world is going to take what we do and medicalize it and turn it into an intervention. Okay. So what we do, I mean, it's so safe, it's non-invasive, and it's cheap, right? People can afford this. So if we're not careful, like I said, we have to band together as chiropractors and use our language. We can't be offended necessarily when spinal manipulation starts coming out more and more, but when we write our papers, we have to use our language. Because it's so funny, a lot of those evidence-based schools, they don't like the word subluxation, right? That's another reason why I was turned off at first. But it's more important than ever that we are. I want to read that. BJ did say in 100 years that MD will be grasping our science and philosophy as their own, while DC continues to miss the big idea. Thank you, Zach. Yes, exactly. So if we're scared to use our words like subluxation, which is, I mean, BJ was way before his time. Maybe he could see light, I'm not sure. But the concept of less light due to a joint not moving properly is so valid. It's insane. And the less we, or the more afraid we are to use those words, the more into the shadows they will become, and the more musculoskeletally based we will become, push more into this small peg, while electrical vagal stimulation becomes the next big thing to treat cancer and different things. They're looking into vagal stimulation to treat cancer, among other things. So what we have is so real and so important. And I hope that it helped, like the more that we start to understand what we do and why it works so well, the more grounded you can feel when somebody random starts to challenge you about what you do as a chiropractor. So I remember one time I was at a undergrad college party, and I always knew I wanted to be a chiropractor. So somebody was saying that they had an ear infection of some sort, and I was like, oh, you should go see a chiropractor. They do great stuff with ear infections. And they're like, well, I'm a speech and language pathologist. This was my roommate, actually. I'm a speech and language pathologist, and the ear has nothing to do with the spine. And because I didn't know enough, I just sat down. I was like, oh, okay. And like became super insecure and immediately questioned a million things about like, oh, well, my parents told me that it was really good. And that's all I had, you know? But being able to put clinical practice experience behind that and see it is the biggest thing. But then to also be able to look back and see the numbers and be like, oh, it makes so much sense. And the more we believe in what we do, and the more confidence we have in our hands, that translates into the adjustment itself, right? Because it's all tone. A lot of patients, I'm a very osseous based chiropractor, even though I do lots of different techniques depending on the case. But some patients do not want that. And I've only had a couple, but where they will only accept like sustained contact. And even them, because I trust myself so much and they trusted me so much, the pre and post, people completely change under very little force, just by changing the input here. So 240. I want to open it up for questions. Let me get to the galley view. Oh, we got some new people here. Hey, everybody. Anybody have any questions?
I'll shoot. So in regards to, you're talking about, because I just got out of school, cheap ways of starting to assess the nervous system, and I think also more effective ways, because I started, even being in CBI, I started realizing there's a lot of easy ways to start assessing people, like things as simple as dehydration, just do cap refill, and that's so simple, and it takes half a second to do. So what type of stuff do you usually do in your office? Is it a lot of the eye movement stuff, or?
Excellent question. I test a lot of primitive reflexes in children and also adults. It depends on the case, but I love testing those. You'll be surprised to see how many positive primitive reflexes there are in adults. Eyes are a big deal to me. I really like testing blood pressure. That's one of my favorite things. And then we just got a heart rate variability set up. So we're going to start testing that. But eventually I would love to see Whoop or something be able to collaborate with us, and so that we could get large scale numbers on the changes before and after. Pulse ox, I also have been testing ever since all the mask stuff has come out. Because that, as I've seen, not every single time, but I've seen that improve as well. A lot of subjective neurological things, like I like to ask every single old person about their dizziness level and certain activities with that. So, like technically, I think that the subjective things are like more important, because that's the person's life. That's like, how is this affecting you? So, making sure that you have goals set, not just objective goals, but subjective goals that are geared towards the person's life is important. Is that a good answer?
Yeah, that works perfectly.
Okay,
That's what I was looking for.
great.
Yeah, I got a question about just like how do you communicate chiropractic to your patients? Because I feel like even as a student, we're kind of like the black sheep almost, to like the mainstream. So how do you like win over your patients when you have such a strong narrative against chiropractic?
Sure. Is that Wyatt that just asked that?
Yeah, that's why.
Hey, Wyatt. Sure. So I would say a good, like, at least 1 out of every 10 or so is coming in because their son is making them, or like they actively are telling me that they don't believe in what I do. So it's pretty funny. I number one is to not get offended, because as soon as we get offended, it really does change the way that our body language is, and changes the words that we say, and immediately begins to lose our rapport with that person even further. So that's number one. Number two, is making it relatable to them. So having some kind of understanding of, like, what did they do? I mean, if they're an electrician or something, talking about the switch box is easy. But making it also not just relatable, but understandable. So letting go of trying to sound smart was a big one for me. Your patients already, like, they're going to know that you're smart as they start to come in and just being around you. You don't have to prove anything to them. So by making it relatable and understandable and simple, because it's really simple what we do, I would say. Also, I hate to give this advice, but, like, letting go of any kind of expectation that you have on somebody else, because not everybody is going to stick around, right? Everybody's got their own decision on whether they want to come in and see you or not, and the people that don't, next, right? You're gonna have a line out the door, and somebody needs you that's in the waiting room. So you don't want to waste all your time and energy on 1 out of 100 people that is trying to get you to prove what you do. There's a bunch of people that, like, I'm sure hundreds of years ago, they didn't believe in gravity, even though gravity is evident all the time, right? But even if you don't prove gravity is real to them, it's still working. I would also suggest that, like, if you can get them at least to agree to get on the table for 1, 2, 3, 4, however many adjustments, that is the big way to win someone over, is, like, the proof is in the pudding, basically. So, great question.
Hey, Dr. Abby.
Yeah, someone else going real quick. Well, I was just going to say really quick, you were talking about, like, ZT was talking about what BJ had said on the medical docs kind of taking over essentially some of the stuff that we've seen and everything, and you're kind of hitting on that along with the vagal stimulation. I actually dropped the article into the chat, and this was like hot off the press. It was only over like 2 cases, but essentially it was through the vagal stimulation. And I can't remember exactly how they did it, but it was a non-invasive stimulation of the vagus nerve, and they were able to find COVID patients in stage 3 were recovering, and actually recovering faster and better than the people that weren't being stimulated. And it was they were trying to say that it was because of, like, the cytokine storm is what was causing people to go into the stage 4 or the ARDS. And this was preventing or helping control that cytokine storm. And so I had another doc, actually Dr. Pat McMahon was the one that dropped this in and was making the correlation between an upper cervical adjustment. We can stimulate the vagus nerve, which ties it into this, but obviously this had anything to do with a chiropractic upper cervical adjustment. It was more of a medicalized stimulation, non-invasive of the vagus nerve. So it was just interesting to hear what ZT said along with what you were saying with the vagus nerve, and so I just wanted to drop that in there.
Wow, that's amazing. Absolutely. Thank you so much for putting it in the chat. I'm going to look into it. And cytokines specifically are one thing that a lot of different chiropractic researchers have been looking into for the last 10 years or so. Not just with being able to decrease it in times when it's too much, but then like cytokines are good for us sometimes. So being able to, that regulation is so important. Thank you. That's amazing.
No problem.
Dylan, didn't you say you were going to say?
Yes. Yeah, I do have a question, or maybe two.
Okay.
So the question is the problem more so that we lack research to prove what we do, or is the problem that we lack the advocacy and actually describing it to people, to like the government, so that they can actually make this affordable for people and go through insurance and all that? Like, what is the bigger?
The bigger issue is definitely the latter. So I really do want you guys to take a little bit of time on Google or PubMed or whichever one, and just research just a few keywords and put chiropractic on the end of it and see what we have already, because there is a lot. The issue is with the organization of the advocation, I think, but even more so, it's a money thing in terms of Capitol Hill and getting more funding for larger studies, right? A lot of our studies are rather small, even though extremely significant. But in terms of like what rights policy, a lot of the times it's going to go with the lobbyist that has the most moolah, right? So I think if we could get on some kind of front as chiropractors, especially chiropractic schools, I know that with life, there are a ton of issues in the student body where the student body morale was extremely low, and people used to joke all the time about like, oh, I'm never giving them any money and different things like that. But when we don't donate towards research itself or advocacy for what we do, or at least associations and different things like that, then we're not going to be investing in our profession, if that makes sense. 100%. That's a great question.
Yeah, thank you. And so yeah, would you recommend like is research something that you want to do personally, or would you rather contribute to the organizations that already exist?
I personally, I would much rather be in private practice only, for sure. Then you guys will see that as soon as you get out there, that it is so fun. But so I would say that if you did not want to get into a bigger role in the research world, and as like so it just as a doctor, there are multiple associations that are very that will advocate for us. Like the International Chiropractic Association is huge. Like they wrote this huge article in combat to Canada's statements and put out a bunch of different research studies saying like American chiropractors can say whatever they want to because what they say is real and people need to listen. So I would say the International Chiropractic Association, if you had to choose one, that's the one. Also, going in person, or I don't know what they're doing nowadays, but to your state association and being able to be a voice there. I know a lot of chiropractic associations have two, a lot of states will have two. Virginia has two. One is mechanistic and one isn't. So we personally go to both, my family and I, so that we can support one and then be a voice of dissent in the other. So, and then like roping the chiropractors in your area to come with you. So getting politically involved individually is important. It's true. Probably more important than the research itself. Yeah, great question. Anything else from anybody?
That was awesome. Thank you so much.
All right. Yeah, no problem.
There were so many.
Yeah, this was so fun. If you guys have any individual needs or like, if you have any questions or anything, I'm going to pass Zach my email and you guys can feel free to reach out anytime. So would love to hear from y'all. Oh yeah, that's my Instagram.
Okay. Awesome.
I've been very active on there about the COVID situation. So if you don't want to hear anything about that, then don't go there. Trying to focus on like our wheelhouse of like health and wellness. That's what I try to do, but then sometimes I'll get into this bad habit of wanting to expose the corruption, basically. But it's fun. It's a balance though.
Yeah.
So.
Well, we really appreciate you spending your lunch chatting.
Yeah.
Just kind of.
Yeah. Thank you guys.
Thank you.
Yeah, I'm here anytime for you guys. Okay.
Awesome. Yeah, I put her Instagram down in the chat, and then when you send me your email, I'll pass it on to everyone else. If I don't have your email, reach out to someone on this, and I can pass on the recording to you if you'd like that. But yeah, I think Alex has something to say before we hop off.
I was just saying, if you need somebody you reach out to any of the Delts on the call.
Cool.
Yeah, thank you very much, Dr. Abbi. That was fantastic.
Thank you. I'm glad you guys enjoyed it.
Have a great rest of your week. And,
thanks. I just wanted to say to keep up the good work. It was awesome to listen to you.
Thank you. You guys too. You guys we're all on the same team here. So, which is Team Human, by the way.
I like that one.
All right, guys. Well, I love you.